Do you feel ready to take the OET listening? Watch this video because I'm going to show you how to understand it and what to do. Hello, I'm Jo from Specialist Language Courses. We are OET Premium Preparation Providers, which means you are in the right place for your OET preparation. Don't forget to subscribe to our YouTube channel and hit that bell so you're notified every time we post a new video. Let's begin. There are 3 parts to the listening exam. A has 2 patient-led dialogues with gap-fill tasks to complete. It lasts approximately 15 minutes. Part B has 6 dialogues or monologues with 3 option multiple choice questions and lasts about 10 minutes. And Part C has 2 long presentations or interviews with 3 option multiple choice questions, and this lasts approximately 15 minutes. Let's start with listening part A. There are 24 questions, 12 for each extract. You have to complete gap fill notes with a word or short phrase. And part A is based on information that a healthcare professional would usually record during a consultation, and the patient says the information you need to write. So what do you need to do? Let's take a look at the strategies for listening A. Begin by reading the context, which will always be provided. Here we can see it says we will hear a pediatrician talking to the mother of a 6-year-old boy called Daniel. This will help prepare you for what's coming. As you can see, you have 30 seconds to read the notes, so use this time wisely. Start by noticing the headings and information in the notes, which will help you keep your place. Then predict the type of information you need to listen for. In number 1, we can predict we need to listen for an adjective. And in number 2, Daniel's pain is described as, again, we know here we need to listen for an adjective. Now you try numbers 3 to 5. So the answers are probably going to be nouns or noun phrases. Let's listen to the first 2.
Mrs. Lowings, I believe you're here to see me about your son Daniel.
Yes, he's 6 years old now, but I wanted to talk to you without him being here, at first anyway.
Yes, of course. So tell me what seems to be the problem.
Well, it's his hands. They're in really bad shape. It's mainly the skin, the way it looks. It's so cracked and dry. He's reluctant to complain about it, but I've managed to get him to tell me that it does hurt. Now, from what he says, I believe the pain is pretty much constant.
Right. Is this accompanied by any other symptoms?
The answer for number 1 is cracked and dry. The paediatrician's question prepares you for the answer, and the description is given by the mum as cracked and dry. Question number 2, the mother says, I believe the pain is pretty much constant. So now let's move on and listen for numbers 3 to 5.
Well, yes. Although there's no itching or anything like that, I mean, I've never seen him scratching them. But the most worrying thing is that there's even bleeding sometimes.
Right.
Right. I just don't understand how they've got so bad.
So when did all this begin?
Oh, it's been months now. I thought it would clear up in the spring when the weather got warmer, because I initially put it down to that cold snap we had last winter.
Yes.
Yeah, and I mean, because that's when we first noticed it. But obviously I was wrong. I've tried to pin down what sets it off, and the thing I keep coming back to is all the hand washing. It makes it worse. And now I've tried to stop him, but it just upsets him if he can't do it, so we've, well, kind of given in.
We can see that Mrs. Lemming signals that the answer is coming by saying, I've never seen him scratching them. We then see the answer is bleeding. For number 4, again, we see the paediatrician's question is signalling that the answer is coming. It's not given straight away as she talks about the spring first, but then we can hear that winter is the answer, as this is confirmed with, that's when we first noticed it. Finally, question 5 is hand washing, and this is confirmed when she says it makes it worse. Now let's take a look at listening part B, what it looks like and how to do it. Part B consists of 6 multiple choice questions with 3 options for each question. Each extract will be a different topic and setting, so the audios are not related, and you have time to read the question and options before the audio starts. It's a good idea to read the context first. Read and understand the question and then underline keywords. So let's do that in practice. Here we can see the context says, you hear a palliative care nurse talking to an elderly patient. Question 25 says, what's the patient most concerned about? It is important to understand the question to focus on what you're listening for. Then let's have a look at the keywords in the answer option, as you can see here. Now listen and choose the answer.
So you've had some changes in your diet. Is anything a problem for you there?
I might be losing a bit of weight because I don't like eating much.
Oh, does that trouble you?
No, I just don't want to eat a lot.
Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you?
Oh, I've had a bit of trouble with constipation over the years. I've taken pills on and off. I've taken something now, actually. But I still feel a bit bloated, a bit crampy.
So it's bothersome?
Yeah, it's not what you'd call slight.
Well, I think we need to have a look at you, maybe make some adjustments to what you're taking, especially since you're getting that bloating.
That'd be good.
And the answer is C. It's not A because the changes don't worry her. She says she just doesn't want to eat a lot. And it can't be B because there are no concerns raised about her new treatment regime. We can see from the script that C is the correct answer, as she mentions feeling a bit bloated, a bit crampy, and confirms that it's bothersome. Let's try again with question 26. Read the context, read and understand the question, and underline keywords in the options. Now listen and choose the answer.
Good morning. Can I help you?
Yes, I've been in a bit of pain. I've got arthritis, you see, but it's not that, it's my jaw.
Oh, have you had this problem before?
Yes, it flares up when I get anxious and, I'm a bit stressed at the moment. I usually take some paracetamol, but I don't want to take too much because, I'm already taking arthritis medication.
Well, paracetamol is usually well tolerated and can be used with your anti-inflammatories. But you're right. Taking that is not getting to the root of the problem. Have you seen a dentist or a doctor about this?
Yes, I've had a bite splint at one time, but, it never really helped.
Well, I'd recommend seeing someone about it again because this can become a chronic problem.
Okay, you're probably right. Thanks so much.
And the answer is C. We know that it's not A because it says, I've got arthritis, but it's not that. It's my jaw. She says, I usually take some paracetamol, but I don't want to take too much because, I'm already taking arthritis medication. So this is what she's seeking help about. Option B is also incorrect because we can see that she had a bite splint previously and not currently. So this is not causing the discomfort. Finally, let's take a look at an overview of Part C and how to approach this part of the paper. Part C consists of 2 longer audios, which are either a presentation or an interview, and you need to understand longer sections of the audio, which contain views and opinions rather than factual information. So what do you need to do? It's a good idea to start by looking at the context, activating your knowledge of the topic. You then have 90 seconds to read through the questions and notice the structure of the presentation or interview and underline keywords in the questions and answer options. So let's practice. We can see that the audio will be about a microbiologist called Dr. Jane Finn giving a presentation about the overuse of antibiotics. Now let's look at question 31. Underline the keywords to understand what you're listening for, and then underline keywords in the options. Now listen and choose the correct answer.
My name's Dr. Jane Finn and I'm a microbiologist. I'm talking today about the overuse of antibiotics, or antimicrobials as they're often called, and the serious dangers this poses for the future. We're all familiar with the threat of a post-antibiotic era in medicine. But how did we get to this point? Well, in the decade up to 2010, we saw a staggering increase of 36% in antibiotic use worldwide. As more and more global citizens were able to access them, usually online, we saw uncontrolled consumption during that period. Although recent media stories suggest the general public has finally got the message that antibiotics should be used sparingly, there's still a hard core who want them prescribed for everything. Doctors are now better at resisting their demands, however, for example when the problem's viral rather than bacterial.
And the answer is A. In the audio it says, well, in the decade up to 2010, we saw a staggering increase of antibiotic use, signalling that the answer is coming. It then says, as more and more global citizens were able to access them, usually online, we saw uncontrolled consumption during that period, linking to option A as the reason for a rise in antibiotic use. Now you try with question 32. Read the question and notice the keywords. It's essential that you understand the question so that the answer you choose fully answers this. Now let's listen and choose the correct option.
This has improved things. For instance, there's been a fall recorded in the overall amount of antibiotics prescribed in the UK in a given 4-year period. At first sight, that's welcome news. The data shows that this decrease hasn't had a negative impact on patients with common infections like pneumonia, but we simply don't know yet if it's made any impression on rates of antibiotic resistance. Other data shows that GPs have reduced the amount of antibiotics they prescribe by 13% over this period. Dentists have also reduced their prescriptions by an impressive 20%. But the figure for hospitals is much lower. So it's not an equally distributed decrease, so the picture's more complicated than it may at first appear.
And the answer is C. Option A is not correct, as the audio states we simply don't know yet if it's made any impression on rates of antibiotic resistance. Option B is not correct, as it's not mentioned and there's no information to the contrary stating that this decrease has had a negative impact on patients with common infections like pneumonia. By listening to the entire section, we understand that the correct answer is C. She talks about different data giving evidence that there has been an overall fall in the amount of antibiotics prescribed. However, the figures in hospitals are much lower, so it's not an equally distributed decrease. So what should you do to prepare for the OET listening? Listen, listen and listen again. Try to listen to a wide variety of different accents to help you prepare for the exam. Remember that listening A carries the most points available with 24 marks, more than 50% of the mark. So start by focusing on the skills for this. Make sure you understand the skills you need to improve for the exam and listen to a variety of online resources. My top tips for OET listening. Listen as much as possible. Use the pre-listening time effectively. Practice using the skills and strategies and succeed in the OET exam. So what podcasts or TV programs are you using to improve your listening skills? Let me know in the comments below. And if you like this video, please like and share with your friends and colleagues so we can help more people achieve success in the OET exam. Don't forget to check out our website, the link's below, to see how we can help you with your OET preparation. See you next time. Bye. So what should you do when you prepare for listening? My top tips for OET listening. I can't remember what they are. Hello, So what should you do to prepare